Diseases of the kidney and the excretory system in ruminants. So renal diseases in ruminants can be non-purulent and purulent. The non-purulent diseases are acute nephrosis, renal amyloidosis, and non-purulent nephritis. The purulent diseases are purulent nephritis and contagious bovine pyelonephritis. Acute nephrosis can be caused by lead, arsenic, and copper toxicosis, as well as hemoglobin nephrosis, as well as monosin and tannins. It's rarely diagnosed clinically, but if it is to be diagnosed, you do a urine analysis and you can see proteinuria and renal epithelial cells and casts. For renal amyloidosis, it's a chronic inflammatory disease. It causes an immune complex formation, as well as hyperglobulinemia. The clinical consequences are enlarged kidneys and weight loss. And in nephrotic syndrome, you can see massive proteinuria and edema. When there's uremia, it causes halitosis and uremic stomatitis and diarrhea. It can be diagnosed with a rectal examination and urine analysis. Non-purulent nephritis, such as glomerulonephritis and interstitial nephritis, show signs of systemic disease and immunocomplex formation. It can be caused by infectious diseases such as leptospira. It is diagnosed with an ultrasound-guided biopsy. And in the urine, you can see proteinuria and renal epithelial cells and casts. Purulent nephritis usually occurs through the hematic genus route. It usually occurs through endocarditis, pyometria, mastitis, and naval infections, usually caused by E. coli, staphylococcus, and streptococcus. You can usually see proteinuria, pyuria, and bacteriuria. And for the treatment, give antibiotics. Do a susceptibility test and make sure they're not nephrotoxic. This means do not give aminoglycosides. In contagious bovine pyelonephritis, it happens in dairy cows around 4 to 8 years old, especially after calving. It's caused by Corynebacterium renale, serotype 1 and 3. These get into the kidney usually through the ascending route. The signs are usually subacute. You can see decreased milk production and fluctuating fever and colic. For the diagnosis, when doing rectal palpation, you'll have a painful enlarged left kidney. And when doing urine analysis, you'll see free ammonia and an increased pH. It'll be around 8 to 9. And Corynebacterium can be cultured. And for the treatment, give benzyl penicillin, procaine, as well as sodium phosphate for urine acidification. And for prevention, have good hygiene at calving. And for bulls, avoid catheterization. For urolithasis in ruminants, in feedlots, in bulls and live animals, it's found around 10%. In post-mortem, it's around 80%. In feedlot lambs, it's around 10% in live animals. And in post-mortem, it can be up to 100%, especially in October and March. The struvites are the most common because they're alkaline. You can also get calcium oxalates, which are acidic, as well as magnesium carbonate, which is also alkaline. The uroliths cause urethral obstruction. For the pathogenesis, it occurs when there's a grain overload. This increases the amount of phosphorus, magnesium, and calcium, and with also decreased amount of water, causes saturated urine. This will cause a nidus formation, and this will lead to inflammation, and then stones occur. It can be asymptomatic, but there's usually abdominal pain. If there's urethral obstruction, there'll be colic. The hind limbs will have a wide stance, and the animals can have dysuria, stranguria, and hematuria. Crystals can also be seen on the prepuce. Sometimes there can be a urethral rupture or a bladder rupture. This will cause undulation, a water belly, which means there's a lot of urine in the abdomen. For the treatment, do surgery or give ammonium chloride. This acidifies the urine. And for prevention, decrease the amount of phosphorus and magnesium in the feed and give enough water and make sure they have vitamin A as well.